Well, thank you all so much for coming out here to celebrate 10 years of Care Clinic. I heard a couple of you ask, why a Sunday night? Why are you planning this on a Sunday night? This is the exact date and time, 10 years ago, January 26th, 5 o'clock, that our first patient walked through our doors at Care Clinic. And so we thought it would be a fitting evening to gather and celebrate all of the work and to let some of the community members who might not know about us, because I think we are still somewhat the best kept secret in Reading, and we don't want to be. So thank you for those of you who are coming out just to learn more. We're really appreciative that you're here. We also wanted to gather, this venue is appropriate because it's between our two locations. We started in the St. John's Hospital, which was the Mayo Clinic Professional Center, and now we're up at the Seminary Professional Building. Beautiful space that's being provided for us by Mayo Clinic Health System. So we're just down the street. If you haven't been to our new location, give me a call sometime. I'd love to give you a little tour. It's a beautiful spot. So, just to introduce myself, for those of you who don't know me, I'm Julie Mallion. I'm the Executive Director at Care Clinic. Although I always say I'm the director, because it's been very clear since the founding that there is a higher power guiding the work of Care Clinic, and I wanted to share a few stories that really show that in our founding of our clinic. The planning committee told me that I have to get up here and tell everybody else's stories. There's no way, they were worried about it getting a little too long, but there's no way I'm going to stand up here and take credit for the work that hundreds of people have done to make this possible. So, as I'm going through and talking about the different groups that were contributed to developing the clinic, if you are able to stand for a little while, probably 15 minutes or something, come stand up here, and it'll just be kind of a growing group so we can see of all of the people who have made this clinic possible. So the story kind of started two groups at the same time. Dr. Dave Asp started a missions group at his church, and yes. And that missions group went down to Biloxi post-Hurricane Katrina and set up 3 clinics. And that whole group, if you want to come on up and join us in the front here. They were sitting around after working hard one day and having some pizza or something and thought, you know, we're traveling all this way down to provide these free clinic services, but I bet there's a need right in Red Wing. And so they thought about that a little bit and were looking for opportunities that they could maybe serve their own community. And as you can see, a lot of these are the key people that helped start clinic. At the same time, and in fact, I just kind of figured out with Jan the same month, Jan Grader came to Fairview as a medical center administrator. She was doing an informal needs assessment around the community and was really noticing that there was a high uninsured rate as well as high uncompensated care at the medical center. So Jan, is she here? Come on, she's here. Okay, Jan was kind of wondering, like, what solution could we come up with for this? And she was driving in her car and heard a radio program come on about in Menominee, Wisconsin, there was a Mayo Clinic physician who started a free clinic there. And she thought, that's a great idea. I bet we could do something similar to that in Red Wing. And yes. And so she was sharing this with the senior center. Here's Jan. She was sharing this with the senior center, and Jack Norgard was in the audience. And he, I don't know if everyone knows Jack, but once he gets an idea in his head, he's going to go after it relentlessly. And so Jack thought this was a great idea to start a free clinic, and he started knocking on Jan's door every week, at least once a week, saying, let's start a free clinic. So Jack, I don't know if you want to come up, but that's right, you're like everywhere. And so Jan, and actually we have the doctor who Jan heard on the radio town besides of Red Wing. So she calls me up and says, do you know anyone from Menominee who's involved in the free clinic? And this Dr. Jim Walker happens to be my dad. Involved in this behind the scenes, and I said, yes, he's my dad, and my mom's on the board too, and can I set up a meeting with him, and then can I get involved, because this sounds like an amazing thing to get involved in. And Neela welcomed me to the group, and it has been such a blessing in my life. Neela really got the ball rolling. This missions group started going, inviting other people, and it was kind of like a snowball going down a hill. We just kept gathering more and more people, gathering momentum as we went down. The missions committee turned into a founding board and a group of volunteers. And so I would love all of you volunteers who are involved in the very beginning of Care Clinic. I don't know if there's room up here, but come on up if you want to and join our group. And Neela is amazing at networking and rallying people around a mission. So as you all come up, probably almost all of you were recruited by Neela Mogard to join this project. And just to let you know, like 60 or 70 of those individuals are still volunteering with us today, 10 years later. Applause to all of these individuals that have kept it going. What a gift to our community. So thank you. Round of applause for Julie for her commitment and dedication, serving all the patients in our community for 10 years. Well, I'm really honored to be here, part of this wonderful celebration. It was a real grassroots effort, as you can tell, and it was just so humbling and inspiring working with everyone as they gave up their time to share their expertise, their talent, and their expertise and their time with our patients. It was really one of the most rewarding things I've ever done. And just a kind of a capstone, a good example, a little story about the dedication of our volunteers, is we did a volunteer survey, probably within the first year of opening. At the time, I think we had about 400 volunteers, and we're like, oh no, what are they going to say? Oh gosh, what have we done wrong? and the largest complaint was that they wanted to volunteer more. I mean, what a testament to the caliber of individuals that have been part of the Care Clinic from the beginning until now. So really have been proud, honored to be part of such an important initiative for Red Wing, our community, our county, and thanks for letting me be part of it. So we had built and planned for this free clinic, but we thought, who's going to come? What does a free clinic patient look like? None of us really knew. We opened on a night very different from this night. It was freezing cold. And I remember about 2 o'clock, we were scheduled to be opening our doors at 4. About 2 o'clock, I saw someone who looked like this, standing at our door, kind of looking in. And so Neil and I went, and he said, are you here for the free clinic? And he said, yes. And I said, come on in. He's like, oh, really? He said, I was planning on just standing out here in the freezing cold for 2 hours? And he said, no, come in. And as he was starting to unwrap his scarf, take off his hood, like, who is this person going to be? And it ended up being a young man. He was 31, and he was sharing his story as he was unwrapping all of his layers. He was someone who was between jobs and had not been feeling well. It was hard for him to be interviewing for jobs when he wasn't feeling well. He'd gone and taken his blood pressure at a pharmacy, and it was really high. So he was thinking that was probably why he wasn't feeling well. So it was really a $4 medication for blood pressure that he was seeking. But there's also a doctor's visit and lots more involved in those costs of seeking care. And so he had come to the free clinic. And we served him. He really was there only 2 times. And then he was back on his feet, back to work. And when we were meeting together as our planning committee, since it was the theme of like the day we opened, the hour we opened, we thought, wouldn't it be cool if the very first patient would come and share their experience? And so with a little trepidation, I called him on the phone because you don't know what's happened to somebody in their life in 9.5 years. And I was hoping that he was in a better place than he was on that frigid, cold day. And when I called him, he said, I'm actually going to be on vacation in Florida. So I would say that's a better place to be in January. And so he was not able to come join us, but he wanted to share a message. And we're going to have Kathy Ast come and share the quote that he wanted to communicate to all of you, because Kathy was there on that very first night of Care Clinic.
Thank you, Julie. I guess I was a privileged provider to be able to provide care to the first patient, and this is what he wrote as his memory. I was so thankful that the Care Clinic was available to me when I was in need of care. At that time, I was between jobs and desperate for care. Care Clinic took me in, no questions asked, and provided me with some great solutions and the care I needed. I am very grateful for the Care Clinic.
We've had some incredible volunteers over the years, but I do have to give a shout out to our AmeriCorps Vista volunteers. You have to come up here. These are 2 of the 3 young women. So they lived at minimum wage while they were serving their And they did so much to build the capacity of the clinic, both in programs and fundraising for the clinic. Over $500,000 raised over those 3 years. And so we're so appreciative to them and to all of our volunteers. If you look on those boards, I know we missed some of you, I'm so sorry, but we had like 625 volunteers, 609 donors that are on, their names are on that board over there. And we're just so grateful for each one of you. We talked about our first patient, but now it's been over 18,500 visits. But we are kind of having a second founding. So we have been open on Tuesday evenings for free clinic, but we have known for a long time that there is a greater need in our community for dental care. Our volunteer dentists have provided, you can see there, 1,850 extractions over that time, and each one of those is wonderful because each one of those is allowing someone to get back to work, to get back to their family. But we don't want to only be pulling out people's teeth, those little kids there. We want to be helping them save their teeth so the next generation can have good oral hygiene. And so we've been planning, we moved into our new space to expand in that area. Then the school district reached out to us and asked if they said we have 60 kids we've identified with dental needs. Can you take care of them? And so we bumped up our timeline and said, yes, we want to take care of them. And, but this graph kind of shows we are going to have a dramatic increase in the number of patients we serve and our costs. We're now open 3 days a week for dental care, And it took us 7 years to get to serving 2,000 people a year, and now within 2 years, we're going to bump that up. We're saying kind of in 2020, we're going to have 2,020 plus new patient encounters. And so we're at that founding place again where we need support. We need people to join us kind of on that grassroots effort and help us kind of with our new clinic. Part of the reason is dental care is expensive, and people on state-sponsored insurances, Minnesota is 50th out of the 50 states for dental reimbursement. We're the bottom. And so it's really hard to provide that care. Right now, this was our projected, but our insurance reimbursements have actually been covering like 25% of our costs for that clinic. And so we're looking for people to learn about us and be passionate about providing dental care for kids and our community members who don't have that access and join us kind of in our next decade and in the next clinic. And it's going to be tough, but we're committed, and I want Sheila Armand, our dental coordinator, to come up and just share one story from one of those kids that we've served from the schools that just is so impactful and makes all the hard work worth it to expand this dental clinic. And also I want to commend Sheila for her holistic care. Of our first volunteer award. In fact, we named it in her honor. As you can see up there, she has volunteered over 3,600 hours at the clinic, and she does it so beautifully and so compassionately for our patients. And so, share your story.
Normally, if I talk to a group, I don't like to read because I like to have eye contact because it helps me not be afraid. But I'm going to read this because otherwise I would talk too long. Okay, this is a story of a little boy, a 6-year-old, that came to us through that cooperative agreement with Children's Dental Health Services and the schools, all right? And and it just kind of gives you an overview of all the people that come together to help the children and all the people in our community. A 6-year-old was referred to Care Clinic Restoration Day Clinic by the school nurse for painful infected teeth that were preventing him from participating in classes. He was seen at Care Clinic 3 times in May to manage his infection. He was given an antibiotic to arrest the severe rampant decay that was causing the infections. However, it was clear that he needed extractions of the 5 teeth that were putting him at significant risk for systemic infection. This could only be done under general anesthetic by a pediatric oral surgeon. The complicating factor was that this child was being cared for by his maternal grandmother, but his mother, who struggles with addiction, had not given legal guardianship to the grandmother. The mother was unavailable, and the child could not have the necessary procedure without legal consent. Care Clinic worked with the grandmother and the county on multiple levels. The MNsure navigator helped to make sure that MA insurance was in place. The dental provider placed an urgent referral. The dental coordinator wrote a letter of advocacy to Child Protective Services per a request from the county social worker. The referral, letter, and documents from the county were presented to a judge, and he assigned legal guardianship to the grandmother. Within 6 days of Care Clinic becoming aware of the guardianship problem, the child was legally placed in his grandmother's care, had the extractions, and continues to have ongoing, life-changing, much-needed dental care.
So we really want to thank all of you who've been involved in these past 10 years and challenge those who are just learning about Care Clinic for the first time. join us in the future vision that we have for continuing the good care that we've provided and then adding that dental care to it. Now I'm going to invite Lori Bell, she's one of our task force chairs, to come and to invite some people to share, some of the key people who've been involved in Care Clinic. Great.
Again, my name is Lori Bell, and I'm going to take a few moments here to just have, it's hard with so many people. It's so wonderful to come together with this group of people who just can't stop hugging each other, right? But anyway, we're going to just have a few people come up and talk about their experiences with the Care Clinic, maybe what the Care Clinic has meant to them, and I'll start. So a few years ago, I was involved in a book club of sorts. Is that better? Okay. I was involved in a book club of sorts with Jack and Diane Norgard, along with some other people from our church. And one of the books we read was Altar in the World. And how many people have read this book? It's good for you. Altar in the World. And that's what the Care Clinic has meant to me. It's been my altar in the world. It's what my husband and I have chosen to volunteer for and also give to on a regular basis. And what we get back is far greater than what we have given. So it's been a privilege to be a part of this organization. Now I want to call up Scott Wortelman. Scott was the CEO of Fairview when this whole thing was being birthed. So here is Scott.
Thank you, Lori. Buck. It's been a long time since I had a microphone in my hand. I'm so unbelievably proud to be here tonight and to see so many friends. I feel like I've come home. And to have watched this develop over the last 10 years is beyond, I think, any dream we ever had when this whole idea was being cooked back in the late 2000s. So congratulations to all of you, and thank you for the unbelievable commitment to this community and continue. You know, I want you to just take a minute and close your eyes. Think about what it's like to be afraid. I mean really afraid. To not know where to turn, to have a loved one who needs help. You may not understand the language. Any jobs that are going to be. Now, think about what it's like to be held, to be hugged, to be gently cared for. That's what you do. You can open your eyes. That's what you do. 18,500 visits. I remember the story of that first patient. It's such an amazing story. You know, I've had 38 years of healthcare experience. 14 of them were here in the Redwood community. I know what a lot of communities are like. There's nothing like this out there. Nothing. And it's because this strong community has continued to come together and just expand these services is so amazing and so gratifying for, I guess, for the old group at Fairview Redwood, which kind of took a risk and said, we're going to support this and make it happen. Jan was magnificent wherever you are, helping to put the plan and really continue to push the model and put this forward. Pam, I know you were out there working with the community, and we worked so hard at that time as a healthcare system to really engage in our community. In fact, one of our strategies was specifically intent on building partnerships in the community. You don't quite know where the road is going to go, but we allowed it to happen. And one of the decisions I remember us making very distinctly when the proposal was coming forward about what role should we play in this developing community clinic, the decision was we will not operate it. We'll support it. And the fear if we would have operated it, is that it would have been subject at some point to organizational stuff, budgets. Look what happens when the community steps forward against it. It was a risk well taken. We're so proud at that time to see it. I'm so proud to have had a small part in enabling to allow this to happen. I know the board I work with, the folks who are on the administrative team, the physicians, many of you are still involved today. Just amazing, amazing. Now I want to just comment a minute on the expansion of the Helm program. What a wonderful, wonderful need to do. You all understand probably too well the limitations to access about the Helm program. You know, when I left Red Wing, I went to work at Hennepin County Medical Center and had the privilege of being a leader there. And one of the things that blew me away when I learned that the #1 reason for people showing up in the state's largest trauma center is dental care. Dental care. We're all experiencing it. Now you're on the path, put that hug around the people who will have it. Thank you for inviting me to be a part of this incredible celebration. It's great to see so many familiar faces, and as I said, it's great to be involved. Congratulations, and now as you look to the future, continue to hug this community and the success of it. Julie, congratulations on your leadership to the board. Keep this job going, and sincerest congratulations. Thank you so much for all you do.
Good evening, everybody. Just congratulations to all of you. If there's not a better testament that it takes a village, all the people standing up here and the people in this room to really accomplish this incredible goal of the free clinic for 10 years. Mayo, much like we heard Mr. Worthman talk about, is here in a supportive role. We're so glad that we've been able to partner in that new space in the seminary professional building, have space and ability to use the free clinic, and now the dental program is just incredible. So we know that there's many of you in this room and many that weren't here tonight that continue to give their voluntary time. Many of them are staff for us at Mayo, past board members, current medical directors, you know, and all kinds of clinicians that give their time for this incredible endeavor. So again, congratulations. Mayo is so glad to be a part of this, and thank you for inviting us in and continuing that partnership. And so thank you, and have a great night.
He was a medical director, founding board member, and 10-year volunteer.
I couldn't say enough about Julie, but she's tired of me creating a hard time. Basically, we've done without her, 10 years without her. But I want to give a shout out also to the volunteers that come every Tuesday evening to see patients, our volunteer physicians, physician assistants, nurse practitioners, and most of all the nurses. Almost all of them come from their jobs, tired, done with work, and put in another 2 or 3 hours with us. And when I think back on when I was working full time, the thought of having to do that was mind-boggling to me. And I'm just amazed that we continue to have those volunteers that are willing to put in their time to share their skills with helping out people in need. Without them, this wouldn't happen either. So keep those people in mind when you think about the care clinic and what they sacrifice, what their families sacrifice to help keep it going. And with that, I would like to close.
Now, Barb Roshan, who was one of our first patients.
Well, the care clinic more or less saved me. I was in between jobs and we had to wait a certain period of time before we could get insurance. And I've got diabetes, so that was a main concern for me. And I asked a friend one time what in the world I was gonna do. And she said, well, go to that clinic. And I said, I'm not gonna go to that clinic. I would be so embarrassed. I know a lot of people from church or whatever. Well, I said, I'll go once. She said, just go once and see what it is. So I did, and everybody that was working that day was so kind and helpful. I went back again and again and again. And one thing, you had the eye doctor come, and when you have diabetes, you kind of worry about your eyes, and I had, that was a relief to me to know after I saw the eye doctor, my eyes are okay. But, no, everybody down there was so nice and kind. I didn't have any reservations about going back, and I would recommend it to anybody. And no, it was a nice experience, and I don't regret having to go that first time at all. In fact, like I said, it was a save, you know, it saved me. So, but, and some of the workers I see here tonight, if I never had a chance to say thank you, I say it tonight. Thank you to all of you guys.
Sarah Oski to come up. She is our resource coordinator. She is a founding board member and a 10-year volunteer.
One of the things that I think I'm most proud of, because of my background, is the fact that this clinic is very well run. Not only do the patients get wonderful medical and dental care, but they come to a small group of volunteers called resource coordinators. And we meet with the folks, we talk about housing, we talk about food, we talk about insurance, and we try to hook them up with local resources. If people are having mental health issues, we make sure that they know the resources that can help them manage their illness. It's really quite remarkable how many people have gotten help. For example, there's a new program in town called Jesus Driven, and it's a volunteer program where the mechanic will give free care in the sense of fixing people's cars or finding a car for people. The only thing he charges is for the parts. We've had several people who have taken advantage of that program so they can go back to work. There's another program that's in town called Care for All, and it's a way to stretch your food dollar. And we refer many people to that, and they come back and tell me the food is wonderful, it's fresh, and they are so grateful because it truly stretches their food dollar. The other thing I wanted to comment on real briefly is the fact that we have so many people who are grateful for the services. We service Hispanic people also, and many times in the last 10 years, because they want to say thank you, we'll show up at the Care Clinic and they have brought dinner for us. All homemade and fabulous. The other thing is we have a woman in the community, and I will keep her anonymity, who every Thanksgiving gives a very wonderful donation so people can have a nicer, more wonderful Thanksgiving. When I have given out the gift cards from the grocery store, many people will cry and say, you have no idea what this means. So I am proud of all the services that the Care Clinic provides. I'm proud of the people in the community who think of new creative ways to be helpful.
Okay, next, we have Mary Ann Valentine. She is our lab coordinator and 10-year volunteer.
Okay, I have been a clinical laboratory scientist for many years. And so when I learned that they were starting up a free clinic and they were asking for lab volunteers, I thought, I can do that. And so I volunteered. I thought, well, you know, I can't imagine that they're going to be too busy. It turns out we do a lot of testing. If you paid attention to the video, it said 6,541 tests we have done. I'm not quite sure what the time frame is, but we make a difference. When I showed up for orientation, Julie will tell people she was more than happy to see us. She was more than happy to turn the lab over to us so that this was something she didn't have to worry about. So there were several of us from work who set up the lab. We had a small room. Used to be the ER's dirty utility room, I believe. It's like 8 by 10, and by the time we covered up the sink and put a couple of tables in and a chair, there was not a lot of room left. We had a patient and a volunteer. It was crowded, and then the interpreter, we had to have one, would stand in the doorway. But we made it work, and it worked well. And now, thanks to the generosity of Mayo, we have this brand new facility up there, and we have a whole room with a waiting room and everything. It works really well. We do have a limited test menu as dictated by our government CLIA license. But we're able to do diabetic testing, lipid panels, hemoglobin, urine testing, strep screens. Anything we don't do, we take up to the Mayo Red Wing Lab. And thanks to the support of Fairview and now Mayo, they have both donated unused equipment to us. So that where we used to do things more manually, we now have some instruments to do things to make us more efficient. I would like to thank all of the lab volunteers that have helped us over the years in our little lab. I appreciate their expertise and their dedication. I know that all of us have found this a very rewarding experience. We could all give you stories about how we felt we made a difference in people's lives with our testing results, and sometimes even helped to save lives. As a longtime volunteer and donor, I have been proud to be a part of this endeavor. I've seen firsthand how we make a difference in people's lives. We are, all of us, a part of what makes this clinic happen. Thank you.
Good evening, everybody. My name is Janet Quilete, and you know, as Barb just mentioned, I went through something similar. When I was new in the country, just 8 years ago, without health insurance, I came with 2 little kids. And after paying out of my pocket the first 2 bills in the hospital, I thought, oh, this is going to be the last time I go to the hospital. But somebody told me, hey, there is a free clinic in town. And I thought, no, I'm not going to go there. Coming from where I come from, healthcare is not free. I mean, it's free, it's bad. You don't want to go. So I thought, I'm not going to go there. That's going to be bad. And when I went to the care clinic, I was moved. I was touched. I wanted to cry. The kindness and the care that my family, my kids received was as good as the one I pay for now. And I thought then, oh, I really need to learn English because I want to be part of this. 2 years later, I started being a volunteer. So it's been around 6 years being a volunteer at the clinic. And I am now an insurance agent in town. And you know how it's that. I mean, I hear complaints all day long. People complain about everything. And I am involved in the community too, so I hear complaints the whole day. People complain about the police. People complain about the school. I myself complain about the school, the system, and a lot of things. But something I never heard a complaint from is the Care Clinic. I am so proud of being part of the Care Clinic. I love the Care Clinic. And now I want to address my Spanish-speaking friends in the audience. Todos saben que yo soy agente de seguros y que escucho reclamos todo el día. Y la gente, nosotros, en nuestra comunidad especialmente, nos quejamos de la escuela. Porque en la escuela nuestros niños a veces no son tratados igual. En la escuela nuestros niños pasan calamidades. El sistema no es para ellos. De la policía nos quejamos también. Pero algo que yo nunca escucho quejas en nuestra comunidad hispana es de la Care Clinic. Y eso me hace feliz. Algo bueno estamos haciendo, Janet. Algo bueno estamos haciendo allí. Y no sé ustedes, pero para mí ir a la Care Clinic es como ir a la iglesia, pero en práctica. So the Care Clinic for me sometimes feels like I went to church. That's how I feel when I go home on Tuesday night, that I went to church. And even better, because it's a practice church. Something that you can just not talk, but do. That's the Care Clinic for me. And I thought Julie would cry. I am so happy that the Care Clinic is here. It's a blessing for all of us. The Care Clinic helped my family, helped my community, whole community, and the Hispanic the most. It's the place where we feel we are accepted. And people there care about us the same way they care about everybody, regardless of race or income or anything. If you have the time, the need, please help the Care Clinic. Thank you.
She went from not speaking English to 2 years later interpreting at the Care Clinic. I don't know, was that really interesting? So then next we have Chris Clausen, who's a school district nurse, dental school public health partnership.
Hi, thanks for inviting me. Before I talk about the dental, I know I've got to be really brief, but I have 1,000 stories. Do you want to hear them all? Coming to the Care Clinic, sorry. But before the dental started, Julie would email me. Last night, Chris, we saw a student and they didn't pass their vision. Can you help out with that? So then I connect that child with the Lions Club. We have so many different groups that help us out and so much support out there, but Julie would always send me these emails and we would try to take care of the kids. I can't tell you how many students would go to the Care Clinic and they would have been absent from school for weeks because they would not have been able to get into a doctor and stuff. So I'll stop with that. About 2 years ago, Rochester Community Dental Health came to me in the summer and asked if our school district would be a pilot program for rural Minnesota, that they would bring dental hygienists and check out our uninsured children or any students that hadn't been to a dentist. Did we want to do that? I said, sure. And she goes, wow, that is great. She had tried 10 other schools and everybody turned her down. I'm like, what's wrong with this? This is great. So it started there. So these dental hygienists would come in and they would check our students out for dental caries and so forth. They would do some hygiene things and they would do fluoride treatments and actually x-rays. Then they were to have their follow-up in Rochester. So that was the problem there. I knew that these students wouldn't be able to get to Rochester. Most of these parents work during the day. They can't take off work. They can't afford that. A lot of them didn't have cars and so forth. So I thought, okay, how can we do a follow-up? We're going to find out these students have issues, and I called Julie. And so that's how it started. And I don't know, you can fill in the blanks there, but Julie said, I'll go to the board and we'll talk about it. And we knew Tuesday night would not be enough to see about 120 120 students that we had for referrals and so forth. So we started out with Tuesday nights, and then the board approved, and then Michaela helped me write a grant. Actually, Michaela, wherever you are, she wrote the grant. I put my name on it. But we got the grant, and so there she is. We expanded into Monday and Wednesday and last year, and I actually got the privilege to bring a couple of their students. Some of our parents were not able still to get the kids in, so we actually drove them from like Sunnyside, and of course they had to have an adult with them, so I volunteered. I thought this was great, and so I got to see the dentist in action with a nice, sweet little 6-year-old boy. And when we went home, he's like, I can smile again. I can't tell you some of the stories high schoolers would tell me. They had never seen a hygienist or a dentist, and they were in high school. And they had such sore mouths that they could barely make it through the day or through tests or anything. So anyway, this program has just been amazing. And so this is our second year, and now we have extra days added. And so now I am going to be out there kind of fundraising. And so I started fundraising last year for our high school food shelf. And we got a lot of money for that, and so now I'm going to see if some of those people will help contribute to the dental program. But anyway, it's a wonderful program, and I am so appreciative of the clinic for helping our students out. Thanks, Julie, and everybody. Okay.
Last but not least, Jane Lorenzen, first board chair. Mental health director, and 10-year volunteer.
So, in brief conclusion, how do we keep the care clinic strong? That's the question we need to ask tonight and forward. A resilient free clinic succeeds with a simple mantra that is shared by all volunteers. I'll offer what help I can to others who need help. If I can't help, I can probably find someone who can. This simple act of helping one another has been repeated thousands of times across the past decade by all of you in this room, as well as many other volunteers who are not with us now. As long as we continue to help where we can and to invite new people to offer their help, the care clinic will stay strong and vital. On behalf of our fearless leader, Julie Mallion, and everyone else who has spoken today, I thank you all in attendance and all who are not here, for the generosity you have shared. And forward we go. Well, there are about 600 more people who could share testimonies like we just heard. And we actually have a videographer, Tom, right here, and Michaela. If you want to share anything, we would love to have you share your story, and we're going to use it on a promotional video, so find him after the presentation. Thank you so much for all coming to spend your Sunday night with us, and for all of the ways that you've supported Care Clinic and the ways you will in the future. Thank you. This is truly a grassroots community effort.